Hey, welcome and happy learning. Today we are going to discuss an important clinical lesion, a dermatological lesion, that is Pemphigus vulgaris. It is a very high-yield topic, so please stay tuned. What is Pemphigus vulgaris? It is an autoimmune disease. It is an autoimmune condition. Mind it, it is an autoimmune condition. It is caused by production of autoantibodies. So you are going to see lots of autoantibodies, and that can be demonstrated locally as well as sometimes in the serum as well. Dissolution of intercellular component is seen as an important feature. So the desmosome, that is an important intercellular junction that forms a connecting junction between different cells, that is being distorted. So desmosomes within the epidermis and mucosal epithelium is distorted. So this is very commonly being asked, what is the target structure? This is desmosome. It's a type 2 hypersensitivity. So it is a localized or antibody antigen reaction, and antibodies are directed against IgG antibody. Mind it, IgG antibody directed against desmogleins. Desmoglein is a protein that is found in the desmosomes, and desmosomes are a connecting link between different keratinocytes or squamous epithelial cells of the skin as well as the mucous membrane. So desmoglein, DSG1 and DSG3 type of desmogleins are being targeted by the IgG autoantibodies. Vesicle and bullae they develop on skin and oral mucosa. So skin and oral mucosa are, so skin can be from any surface or any side of the body. Oral mucosa is more commonly targeted, but virtually any kind of mucosal surface can be targeted. Flaccid bullae blisters are being formed, and there is a fragile epidermis, and there is a blister is quite flaccid, and loose kind of blisters are seen. Blister is painful, and there is erosions, superficial ulceration of the skin and mucous membrane. As you can see in the image, the erosions can also be seen, and you can see the fluid filled lesions, the bullae, are being seen over here. And the two common clinical signs that you need to remember is Esbo-Hensen sign, that is the bullae when do spread laterally when the pressure is applied from the top, that is known as Esbo-Hensen sign. And Nikolsky sign, that is with a gentle traction or rubbing, new blisters or bullae may get formed, so that is known as Nikolsky sign. So Esbo-Hensen sign, Nikolsky sign, this may be there in your vignettes and option. These are important high-yield signs, clinical features of Pemphigus vulgaris. Pemphigus vulgaris, important thing is that there is intraepithelial vesicles and blister, and typical location is suprabasal. So just above the basal layer, you can see the breakage, the cleavage of the epidermis, and here you can see in the bullous cavity or in the blister different keratinocytes become demarcated from each other, become separated from each other, they become dispersed. So acantholytic keratinocytes are scattered throughout the blister cavity, and there may be some inflammatory cell component that also may be seen. And in this process there will be, you can see over here, in basal keratinocytes will be just seen as a linear row kind of a thing. So there will be a linear row, and this linear row is known as row of tombstone appearance. So row of tombstone appearance is seen, and acantholytic bullae is seen in the suprabasal location. These are the two important features. And the DIF study, the direct immunofluorescence test, if we do, we are able to see this net-like deposits of IgG and complement. So here you can see net-like process will be seen. So diffused distribution is what we call it as a net-like distribution, and we can specifically detect IgG and C3 complement that can be detected. So most importantly, most commonly it is IgG. Very rarely we can also get IgA type of Pemphigus vulgaris as well. Now coming to the treatment, how do we manage? So we can give rituximab. This is one of the drug of choice in moderate to severe cases. In refractory cases, or when this rituximab is not available, systemic steroid may be tried. And immunosuppressive therapy like azathioprine, this mycophenolate, methotrexate, cyclosporine, these immunosuppressants are also tried with success. Intravenous immunoglobulin, even plasmapheresis has also been tried with success. Dapsone can be given specifically for IgA type of pemphigus, which is quite rare compared to the most common IgG type of pemphigus. And To have a quick recap, it is an autoimmune reaction with IgG antibodies against desmoglein. Skin and oral mucosa are implicated, and there is a bullous lesion with a suprabasal acantholysis that is important. DIF studies shows net-like IgG and complement deposits, and the treatment include immunosuppressants, immunoglobulins, and steroid. Thank you. Thank you for watching the video. Please subscribe to the channel, hit the bell icon, and follow in our different groups. And please stay tuned for the next video. See you in the next video. Thank you.